And as I said, I'm very fortunate to work with some of the most brilliant colleagues that I've known in my career, which is now getting longer and longer, from Minnesota, Arizona, and Florida. So we have all the Mayo sites that are represented for an enterprise conference that are here for you today, and I think you'll be pleasantly surprised with some of the quality of the speaking that you'll see. So within our course, Epilepsy and EEG in Clinical Practice, we want to try to focus in on the diagnostic and treatment issues that are important for the clinician that's actually managing patients. I'd like to start out by talking with you this morning about some of the innovations and revelations in epilepsy. As I said, my name's Bill Tatum. I work at the Mayo Clinic in Jacksonville, Florida. I'm professor of neurology there, and I hope to provide you with an overview that might act as a platform for some of the excellent presentations that are going to follow. These are some of my disclosures. There's a patent that's pending on something I'm going to show you later in the recording or in the presentation. But epilepsy is now classified as a brain disease. That is, in the past, we've always felt of it as at least 2 unprovoked seizures or reflex seizures occurring more than 24 hours apart. Well, the new definitions have now revolutionized that to include a single seizure with enough information to suggest that somebody that has greater than 60% likelihood of a recurrence now can be given that designation of an epilepsy diagnosis. And that means about 1 in 26 people, or about 1.2% of the general population, have this condition. That's more than 50 million people worldwide. And we have about 3.4 million just in the United States. And at 1%, you can pick your city in mind and quickly calculate how many people are in your local area that have this condition. Most will have focal epilepsy, and most will have focal impaired awareness seizures or focal aware seizures. The new classification system that you'll hear about from Dr. Hirth in just a bit has 3 key features: the onset, the level of awareness, and whether it's motor or non-motor. And there's an age relationship that reflects the cause. So what happens in early childhood and the neonatal period is very different than what happens to us later on in life after the age of 61. I'm 61. So I like to show you some of the impact of seizures and